Hello humans, and welcome back to my channel. If you're new here, and we have some new people here because recently I had this Traya video come out. Sorry, Traya video come out, and there have been new people here on this channel. So, if you don't know who I am Dr. Pavitra Shankar. When I started this channel back in 2019, I was a medical student in my final year of MBBS, and today I'm a practicing psychiatrist. A lot has changed in all these years. I haven't really been particularly particular or very regular on YouTube. I've had phases of on and off, majorly because of some personal struggles and just life and residency getting in the way of things, and just me having a lot on my plate to figure out. However, I have made many attempts to sort of be regular, and I've never really understood why I could not ever do the social media thing as regularly as many other people are able to. Even like very busy clinicians these days are spreading wonderful information online, and I genuinely like to make videos and I genuinely like making content. But something that has been very common to what I was in 2019 to now how I am in 2026 is just a very real fear of judgment and a very real fear of why would people listen to me, and just having something which we can call an imposter syndrome, which is something that I'm now starting to realize as I practice psychiatry and I see more patients daily, that this is something very common, specifically in people in the medical background, because we belong to a culture of professionals where genuinely there is no amount of experience you can have and no amount of years of practice can make you feel like you are the master of something. There is always a scope of you not knowing things, and there's always a scope of someone being better than you at something that you do. And also, it's not really a very forgiving culture that we train in, so there are a lot of mixed causes for why that might be, and honestly a lot of it is internal as well. I have this chronic sense of feeling that maybe there are certain things that I get which I do not deserve at the point when I get them. And this has been consistent earlier when there was a TEDx talk, and now also when I got a call from Traya, or whenever I get any opportunity for that matter, or even when I got the job that I'm currently doing. And very recently, I met my mentor, who was my thesis guide, who was the iron lady in my department, and someone I really look up to. And I got to meet her after a long period of time. And she asked me why I was not doing certain things that I should be doing right now. And it is something which people at my mental health center also do ask me, and I genuinely don't have an answer to a lot of these questions. I don't know why I don't do YouTube regularly. I don't know why um, I'm not organized enough as I should be in my practice, and I don't know why I shy away from any sort shy away from honestly doing anything extra which I'm not confident in, even for my patients, which makes the whole curve of me opening up to experiments and newer drugs and newer interventions very slow, because I guess somewhere there lies a feeling that maybe there will be judgment, or maybe there'll be the feeling that I should not be the person initiating things. But, and when I discussed this with my mentor, it is something which she pointed out that it's not unique to me. It's not something that is unique to honestly anyone. in our profession specifically. I know imposter syndrome and just not being confident enough in your own abilities is not something very medico specific, but it is highly there in us, and I commend and applause everyone who's able to get past it. uh, but yeah, and honestly, these days, sometimes on some days psychiatry practice is super easy, super fun, super chill, super humbling. Sometimes you get a lot of lessons, but on some days, honestly, it is very hard. It is hard to talk about human emotions. It is hard to um, constantly be the one who gets all of other people's things unloaded onto them, and it is hard to see every day that people live in realities which are just beyond one's imagination, because we all like to think that we have a protected shell and we live in a protected environment, and that we, in some way, we all want to deny that we don't live in a world where even homes are not safe, or when where unpredictability is the rule of life. But psychiatry practice does make you question all of that. And on most days, it is fine. But on some days, and recently these days, I have been feeling quite overwhelmed by it. And that's when I started to realize that while I am achieving things at the right pace, um, professionally, and things are going well personally as well, uh, all of us need to have some outlet of where which is somewhere between professional and personal, where some sort of creativity should be there. And it is an evidence based thing also. It is just that we forget to implement it on ourselves. One of the few advices that I frequently give to my patients also is to do more of what they love. And when I ask the same question to myself, yes, making videos, talking on camera, talking about my life, and writing, editing, these are things that really do give me joy. And I remember when I started in 2019, if I do look back, there was a sense of trying to fill in a void when I started it, and using that creative energy to make videos, to create, was genuinely something that I enjoyed. But somewhere along the way, you let sort of all your insecurities creep in so much that it becomes difficult to continue further. But I hope I can change it this time. I hope, and whenever I go through, whenever I go back in this channel and I see older videos, it's mostly us just talking, me and everyone else just talking about how how silly and how good and how bad and how just overall unique the life of a doctor is, and how it's so much mixed emotions. And now when I sit every day and I talk about emotions, I guess again, this is something that psychiatry really is unique at, is making you talk about your emotions, making you think at least about your emotions, not particularly talk about them, but when you talk about emotions so much, you cannot help but reflect on your emotions as well. And if anything, it does bring a sense of, at least in some ways, it improves one's emotional intelligence for sure, um, to whatever their maximum capacity is, and it just does make you a very introspective person. Some may call it overthinking people, but I would want to call it introspective people. But yes, man, the when I chose psychiatry, I did not realize just how complex things can be in mental health, which is amazing, which is an amazing challenge that I'm always up for getting into. It just warms my heart whenever I'm able to sort of untangle, detangle, look at, solve a problem for a patient, see the change that comes when that suffering goes away and treatment is initiated. And first of all, it is accepted that someone is going through mental health crisis, and then treatment is initiated. Um, and the way it changes one's dallies and just their suffering and their functioning, it's just beautiful to see that as well. I hope everyone after us who takes up psychiatry knows precisely that. Some people do believe that it is not a branch where you get a lot of satisfaction, it is not a very satisfying branch, but at least till now I've not thought of it that way, and I don't see it that way, because I don't see a more satisfying outcome in anyone's life when you're able to treat years of misbehavior or years of disturbances in one's cognition, emotions, working, when you're able to bring someone to the point where they're able to live without hallucinations, without their delusions, are able to hold a job, live to the best of their capabilities despite having severe disabilities, then psychiatry can offer you. So I genuinely hope that everyone who practices in the field of mental health, and even I, continue to see this as an opportunity rather than a challenge. Challenge is it obviously is, but then it is at the end of the day equally rewarding. So yeah, this is just a catch up video. Thank you so much for joining in, and if you are also someone who's in the field of healthcare or mental health, if there's anything you want to share, please do share in the comment box below. And thank you so much for watching.